You know, King 5 is committed to bringing you the facts on the corona outbreak. And here in our area and across the U.S., that is what we're keeping an eye on this morning. According to Johns Hopkins University, there are nearly 125,000 cases in the United States. That's up nearly 20,000 cases since yesterday. COVID-19 deaths in the United States have doubled in the past 2 days, and that number is at more than 2,000 right now. More than 3,200 people have recovered from the virus. And the Washington State Department of Health says they have confirmed 4,300 coronavirus cases, 189 deaths tied to the virus, and close to 55,000 people have tested negative for the virus. That's 93% of those who took the test. And today, soldiers will begin transforming CenturyLink Field Event Center into a hospital for patients who do not have COVID-19. Governor Inslee announced the military will be converting the event space into a hospital. King 5's Callie Greenberg is live outside the CenturyLink Field Event Center with more details on this. Callie?
Good morning. Those 300 soldiers are going to turn CenturyLink Event Center here into a fully functioning hospital. It will have nearly 150 beds. There will be surgeons on hand and a full pharmacy. And we're learning that supplies to make this happen, they're already on the way. They want to get started today. Now, the goal of turning the event center into a hospital is to ease pressure on the healthcare system here in Washington State, as they expect the number of coronavirus cases to continue to rise. Now, yesterday, Governor Inslee made this announcement, and he applauded the steps taken by the U.S. Army Corps of Engineers as well as FEMA to get this hospital up and running. And what's important to understand is the field hospital here, it's going to be for non-coronavirus patients, those who need medical treatment for things such as car accident injuries, or maybe if they break a bone.
It's going to treat people who do not have COVID-19, but it is every bit as heroic in this effort, because every single person that the 627th treats is going to free up a bed for those people who do have COVID-19 in our other facility.
Now, those 300 soldiers, they arrived here last week from Colorado, and Mayor Jenny Durkan says they're going to be in and around the Seattle area assisting local healthcare professionals with things exactly like this, helping build this hospital. Now, the soldiers are expected to get started on work today. They are going to move quickly. They want to have this hospital open within the next week. But as far as the need goes, to put this into perspective, a new report by the University of Washington says likely Washington State will be battling the coronavirus into July. So that just goes to show why a facility like this will be needed. Back to you.
You know, Callie, such an important thing. I've talked to so many friends of mine in healthcare saying, we just don't have enough space, and it's clear now with the Army opening this hospital, they're trying to fix that. Thank you. Happening today, King County will open a former Issaquah hotel as a place for people who need somewhere to isolate or quarantine themselves. The facility joins two other county sites, as a Kent motel and modular units in North Seattle already are being used for quarantine or isolation. We're told the facilities have 24-hour security and that people there will be monitored by medical personnel. Meals will also be provided. President Trump quickly backed down from an idea he floated around this weekend to quarantine New York, New Jersey, and Connecticut to slow down the spread of the virus. NBC's Chris Pallone has details.
As COVID-19 infections spread, President Trump now says he will not institute a travel ban, or quarantine as he called it, on the hardest hit areas of the Northeast. Here's the president leaving the White House Saturday afternoon.
This would be an enforceable quarantine, and I'd rather not do it, but we may need it.
It would have affected people in New York, New Jersey, and Connecticut for 2 weeks. The president believes people leaving the region are spreading COVID-19 to other parts of the country.
Because they're having problems down in Florida. A lot of New Yorkers going down. We don't want that.
But Saturday night, the president tweeted a quarantine will not be necessary. He tweeted instead the Centers for Disease Control will issue a travel advisory for the area. Earlier, the announcement appeared to catch the state's Democratic governors off guard.
I don't even like the sound of it.
As soon as the president floated the idea, legal experts and elected officials questioned whether the federal government could enforce large-scale travel restrictions on individual states. And even if it could, medical experts said it might not be effective.
Unless all states do it nationally, nothing is going to stop us from going from a high-risk area to a low-risk area, and it's a natural human instinct to want to do that.
The president's remarks came as he traveled to Norfolk, Virginia to watch the departure of the USNS Comfort, a hospital ship which will add 1,000 beds to New York City, which is straining under a crush of coronavirus patients.
It's like a war zone. We're in a war with very limited resources.
While much focus remains on the nation's hardest hit region, infections are already exploding across the country. Louisiana with the fastest growth rate in positive tests in the world. Los Angeles anticipating a hospital crisis like New York's in just a few days as the nation tries to slow the spread of this deadly virus. Chris Pallone, NBC News, New York.
And the CDC travel advisory urges residents of New York, New Jersey, and Connecticut to refrain from non-essential domestic travel for the next 14 days. It states that it says the state's governor will have to, form the discretion to enforce the advisory. Essential services like trucking and healthcare workers are exempt from this. So King 5 asked Governor Inslee yesterday whether he and the president spoke about any potential quarantine around Washington. Governor Inslee says there was no discussion with the White House about that, and there's been no discussion in the state either. But Inslee did call on citizens to cut back on travel.
We should be making these decisions about our travel decisions today. We don't need any political leader. I'm just calling on fathers and mothers and young people to make their own decisions, which means we need to reduce travel dramatically in the next several days.
Let's take a live look at SeaTac right now. We've learned that a second TSA officer at the airport has tested positive for coronavirus. The departure deck looking pretty empty right now. Not a lot of people traveling at all, but a TSA spokesperson tells us the most recently diagnosed worker was assigned to checkpoints 3 and 4. And the last time he was at work was on Tuesday, March 24th. The TSA says if someone believes they may have come into contact with this officer at some point during their travels and they are concerned about their health, they are asked to reach out to their medical provider or local public health department. Both TSA officers who've tested positive for the virus are resting at home. Happening today, the Washington State Ferries moves to a reduced service schedule. It's part of the state's coronavirus response. Plus, ridership is down about 60% since the governor issued the stay-at-home order. Sailings on the Seattle-Bainbridge and Bremerton routes are being reduced by about half. And the Fauntleroy-Vashon Southworth routes are going to move to a 2-boat schedule. The schedule is expected to last until at least April 25th.